The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Of course, you already know Schaefer Eye Center as the destination for designer eyewear. Cartier, David Yurman, Sama, Robert Mark, Barton Pereira, Salt, Oliver, Peoples, and many, many more. With over 3,300 frames available, we can help you find the perfect pair for your individual needs, style, and budget. The Schaefer Eye Center experience is all about you, but it begins with our people. Our doctors and vision specialists are committed to giving you the best in comprehensive eye care. Hi, I'm here at the new Schaefer Eye Center with my new friend, I guess new after 2 years, but this is Mr. Stephen Allen, lead architect from Williams Blackstock, that planned, developed this whole facility with me. And so first of all, thank you very much. You bet. We absolutely love it here. So when you first walked in this building, when I took you here, what were your thoughts?
Well, it's such a large building. I was at first a little flummoxed as to why would you be selling eyeglasses and eyewear and patient care in such a large building. But after talking with you further about it, I realized you've got a real vision about creating a whole experience and enhancing the Schaefer Eye Center experience, and that this building was a huge canvas for you to do that. So that was really exciting.
Well, you captured my vision, my dream, and all of our dreams. When it was done, because I have a hard time picturing things finished. I just knew what I wanted. When it was done, other than the fact that I wanted everything white, when you walked in, what did you think of the finished product?
Oh, I continue to be astounded and amazed. And really I feel like we were a vehicle for your vision and for all of your staff's vision. I hope that it really creates that unique opportunity, that unique environment that you're seeking, that is a little bit unique just to you, but it's also very much caters to the patients. You talk a lot about, I was taken by your talk about science, service, and style. And I think that's important, and I'll leave the science to you. I think you're probably much more suited for that. But the service and style, I think we try to embody that and create a place that is about service, but also speaks very much to your style and to the opportunities of style that you provide for your patients.
And again, I say when you come see the facility, you feel it. You walk in, we made the waiting room comfortable, so you're separated, but yet you can see what's happening. You made the optical into a trip down New York or LA, as we call our runway. And then, of course, the key part, the clinical area, is set up so we can efficiently see the patients with all the special equipment. So literally, my vision has been accomplished for this, and I can't wait to see the rest and just officially for all of Schaefer Eye Center. Thank you very much.
Thank you.
And y'all come visit. You can't believe what we've done. Welcome to the new Schaefer Eye Center. I'm so excited for our whole team at Schaefer Eye Center at our new flagship office in Hoover. This is where I started practicing, and this is where we built the prototype of what you're going to see in all of our Schaefer Eye Centers. Schaefer Eye Center is about science. That's taking care of your eyes for a lifetime with a great eye exam. We're about style, and this is style. Visit our runway and all the different optical options you're going to have, with the most fashionable frames to the most basic frames and every lens technology you can imagine. And we're about service. Service is about taking care of you, but also taking care of the city of Birmingham, of being a partner. We've been part of Birmingham for over 30 years, and with all of our employees and all of our doctors, I welcome you to the new Schaefer Eye Center. So let's start with a tour. A tour of Schaefer Eye Center starts with an eye exam. So follow me as I take my suit off, put put on my white coat and take you through what's going to happen at the highest level of eye care that you're going to find.
Evolution is a constant. It knows only one direction: forward. Advancing, adapting, modifying, learning from every moment, every experience to transform right now into what's next. Because vision is evolving. Are you?
An eye exam starts with a comprehensive workup, and the staff at Schaefer Eye Center are here for you. They are wonderful at what they do, and they make sure we as doctors get all the information we need before we even start your eye exam. And it starts with the OptiMap. We make sure we have the picture of the entire retina when you come into the exam room, so we know about your medical history and your retina. Next is your glasses. We want to make sure your glasses and contact lenses are perfect. And at Schaefer Eye Center, we start with computerized equipment to give us a great start. But we promise you this, at Schaefer Eye Center, the doctor himself will find out if your prescription is accurate. We don't use any extras. We use doctors to make sure your prescription is just right. Next is visual fields. You never know if there's something wrong with your peripheral vision. So at Schaefer Eye Center, we start with the Zeiss screening to make sure that anything out in your periphery that's causing any changes is measured and watched. We know that nearsighted people, sometimes up to 12%, have a visual field defect, and it's very nice to know that before we start the eye exam. Next is the LipiView. We will talk about this more about dry eye, but we also may look at your tears and see how thick the tear layer is. This is the only piece of equipment like this in the state of Alabama. And again, to our newest and greatest invention, and that's called the ClearPath Diabetic Screener. Without taking any blood out of your system, we can take a picture of your eye and tell you if your blood sugar is where it should be, and if there's something we should be looking at, whether it be diabetes or pre-diabetes, before you'd ever know. At Schaefer Eye Center, this is how it starts. Now that you've completed your workup, the doctors will see you in one of our multiple exam rooms in this wonderful clinical area. We are really enjoying the pleasure of the space and all the latest in ophthalmic equipment to examine your eyes. So now you've completed your workup, the doctors have examined your eye, and now you're in our favorite rooms. We have 2 complete medical testing rooms for those that have medical issues: macular degeneration, glaucoma, hypertension, diabetes. We have to monitor this and make sure that we're taking care of you so you will see for a lifetime. So we start with a retinal photograph. This happens to be a picture of someone that has a genetic disorder. And we watch that also, just like everything else, because in today's time, we can see so much when we can monitor you not only with our eyes, but 3 different types of retinal cameras. Next, we go to the OCT. So we talked about, first of all, people have macular disease, macular degeneration, glaucoma, but also a key today is floaters and flashes. If you do have flashes and floaters, get in immediately for an eye exam, because here's a patient that, Dr. Mark Schaefer, you want to tell us what you're seeing here?
What we're seeing here is in the central part of your vision, which is your best area of vision. We see some elevation here that's actually causing this patient to have decreased vision.
And this is due to pulling on the eye from the vitreous that because of floaters and the vitreous coming forward. But a lot of this we couldn't see in the past, and we know this is treatable. If we treat it fast, you will not have to lose your vision. Next is one of our key tests, and this helps us diagnose macular degeneration earlier and any changes. So it's called PHP. And what it does is if we see a change in the macula, through this we know that you're starting to go from a dry to a wet AMD, and we want to get that quickly because today we can stop that degeneration. Again, the medical testing at Schaefer Eye Center is what separates us from the rest. The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Perfect vision. The freedom from wearing contacts or glasses can be yours with Schaefer Laser Vision. We helped pioneer the use of LASIK surgery in Birmingham over 20 years ago, and our own Dr. Jonathan Wilson has performed over 80,000 surgeries, including more than 300 eye doctors. Just imagine being able to see well into the future without wearing contacts or glasses. At Schaefer Eye Center, our new children's optical is just phenomenal. It's so much fun. Kids like these are just having a great time. Foster, what do you think? You love trying on glasses? It's so much fun. How about it, Edith? Show us a great pair. And Edith will show you that kids can just have a great time. We have such a great selection because, again, children love the coolness today. They love the colors. And Maddie, what do you think of your yellow glasses? They love them. Again, at Schaefer Eye Center, we're not just about style for adults. We're about making children happy. We've talked about Schaefer Eye Center, our new children's initiative. Contact lenses are the most important thing that you can do with contacts and make sure that our children take care of their eyes for a lifetime. Emma Kate is a contact lens wearer. So not only do we have great technicians like Alex here that is training her how to put the lenses in and out, which is really the simple part, it's also how they take care of the lens. We know that children have the most problems of all demographics due to corneal ulcers, infections, and just not taking proper care of the lens. That's why we see all children every 6 months. Schaefer Eye Center has a rule: if a child wears contacts, anybody under 16, they will be seen every 6 months, so we make sure they're taking good care of the lenses, right?
Yes, sir.
And we make sure that you love your contacts, don't
Yes,
you?
sir.
And we saw Emma Kay trying on glasses because all children that wear contacts should be wearing glasses. Now, when we go in the exam room, we're going to talk about nearsightedness and children controlling that nearsightedness. If we fit the child properly and the right kind of contacts, there are studies now that shows that we can stop their nearsightedness by up to 40%. That's what I said. 40% reduction in nearsightedness just by wearing the right kind of contacts. So that's you, Emma Kate. Well, you're not going to be nearsighted anymore, right? And then when she does, we'll fix it with laser surgery. Isn't that right?
Yes, sir.
Yes. No matter who you are, the Schaefer Contact Lens Center of Excellence will provide you with healthy, accurate, and comfortable vision. Bad habits like oversleeping in your contact lenses are a major cause of infection and vision loss. Our doctors are contact lens experts. We will ensure the safety of your vision. Young people in contacts are at a high risk for complications. We will be your ongoing partner in their vision care. We take your child's eye health seriously. If you are wearing monovision contacts, one for reading and one for distance, a better option is multifocal lenses. Your vision needs evolve over time, but you deserve precise, effortless vision. If your eyes hurt by the end of the day, you could suffer from dry eye syndrome. Using the latest medical technology, our doctors will customize your treatment to give you clear, comfortable vision. Trust in the expert care at Schaefer Eye Center. At Schaefer Eye Center, we've talked about the Children's Initiative, and people ask us all the time, how old should I be to have an eye exam? So Maddie, how old are you? 2? 2.5? Yeah, how about that? 2.5 is a good age to start. But what about an infant? Because we have something called infancy. If you have a child that is under 6 months of age, an eye exam is free because we like to know how their vision is from that age to make sure that they are seeing well. Actually, Dr. Kaplan's under 12, right?
Under 12, 6 to 12 months.
6 to 12 months of age. Edith, how old are you?
7.
7, and she's had an eye exam because when you enter the first grade, is that what you're in first grade? You have to have an eye exam to know how you're going to compete in school and make sure you see well. And Kate, how old are you?
12.
12. Are you driving yet?
Yes, sir.
No, I don't think so. But I know you've had a lot of eye exams, right? Because her father's a doctor at Schaefer Eye Center. And Foster, how old are you?
11.
11, and she's had lots of eye exams because her mother is a manager at Schaefer Eye Center. So we have all the families. Dr. Kaplan is looking at Foster's eyes and McKay. And I want to thank y'all for being part of this whole children's program. Again, I explained this earlier when we were talking about contacts, but every one of these children have a good chance they're going to be nearsighted. And we know today, with special programs at Schaefer Eye Center, we can slow down that nearsightedness. And this has started at the University of Houston and now moved to Australia, and soon at Schaefer Eye Center, because we have programs that will hopefully help your child have a 40% reduction in nearsightedness as they get older. And it's not just about less nearsightedness. When they get older, less glaucoma, less retinal detachments, less medical problems, because we started at this age to make sure you're wearing the right contacts and the right glasses. Again, thank you for watching, and thank you, everybody. Wave to your friends. Say goodbye. Of course, you already know Schaefer Eye Center is the destination for designer eyewear. Cartier, David Yurman, Sama, Robert Mark, Barton Pereira, Salt, Oliver Peoples, and many, many more. With over 3,300 frames available, we can help you find the perfect pair for your individual needs, style, and budget. You've now completed your eye exam. We have the right prescription, and now it's time to have fun. It's time for the Schaefer Eyewear Experience. And we're going to take you to our runway, and we call this the runway because it's about fashion. You know, if you're in New York or Los Angeles, the key brands all have their own optical shops on every corner of Madison Avenue, Fifth Avenue, Soho, and of course Rodeo Drive. At Schaefer Eye Center, we brought that all under one roof just for you. And we start with two favorite designers, LEI Works and Anna Valentine. Both unique shops, unique designers around the country. As you go through what we call our style suites, we start on your left with Robert Mark. Robert Mark has multiple stores all over the country, including almost 5 on Madison Avenue. But at Schaefer Eye Center, again, we have the Robert Mark suite. To the right here, you see the Sama suite. Sama, one of our favorite designers. Sheila and Ross are great friends and just wonderful people. Next, we have Barton Pereira. Later, you're going to hear from the president of Barton Pereira, Billy Barton, who happens to be visiting today, and he's going to tell you a little bit about the new Schaefer Eye Center. But again, Patty is one of the best designers of eyewear in the country today. To your left here, we have Oliver Peoples. Again, Oliver Peoples is one of the first people to start the new coolness of eyewear. And to the right here, we have Salt, again, one of our favorite brands. They like to think of their real cool brand with no names and just a clean, nice look. And again, the suites keep going. We have Judith Lieber, David Yurman, Tom Ford. You name the brand, it's available here at Schaefer Eye Center. But I also bring you to the normal Schaefer Eye Center, and this is where you see all the glasses that you see in every optical throughout the city. And why do we have these? We make sure we have whatever you need. You know, when you have insurance and you say, I want my glasses paid 100%, we have over 200 pair of glasses that you can get paid 100% with your insurance. But let's say you just want to spend a little bit more. We take some of our best brands, and every few months we'll put them on the boards and allow you to buy the best, most expensive glasses for less than $100 with your insurance. Again, at Schaefer Eye Center, we're here to serve you. Whether you want the highest style and some of the best products in the country like Cartier, or you want something that's more budget but high quality, at Schaefer Eye Center, we are listening to you and we have what you need. You know, we've talked about the Schaefer Suites and the new flagship Schaefer Eye Center, and I'm here with one of my closest, oldest friends in the optical business, who we are officially today naming the Barton Pereira Suite, since he is Mr. Billy Barton, president of Barton Pereira. And I know Patty, we love you. She's really the brains, right? Not you.
There's no question. Patty is the secret sauce to the Barton Pereira formula.
But we have the whole Barton Pereira team right here with us, Axel and Celeste, and I've known that forever. But Billy, what do you think of the new office?
It's, you know, you go all over the world, because I do go all over the world, and this, I've never seen anything like it. It's amazing.
Well,
It's well done.
Well, you know, it is a great place to house your frames. You know, I know Billy's so proud of the stuff he's done, and so have I. Know you've been Oliver Peoples, Chrome Hearts, you've done everything, and you've really made a difference. And first of all, I want to thank you, and this is the official raising. If y'all would raise it up for me, because this is your new suite, the Barton Pereira Suite at Schaefer Eye Center.
Well, we couldn't be happier. Thank you.
The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Of course, you already know Schaefer Eye Center as the destination for designer eyewear. Cartier, David Yurman, Sama, Robert Mark, Barton Pereira, Salt, Oliver Peoples, and many, many more. With over 3,300 frames available, we can help you find the perfect pair for your individual needs, style, and budget. The Schaefer Eye Center experience is all about you, but it begins with our people. Our doctors and vision specialists are committed to giving you the best in comprehensive eye care. Whether it's your regular exam, new frames, LASIK surgery, dry eye treatment, finding the right contact lens, or even helping you navigating your insurance options, everyone at Schaefer Eye Center is focused on one thing: giving you clear, comfortable vision. Are you ready to evolve your eyes? Experience it for yourself. Visit Schaefer Eye Center today. So now we're going to talk about the Schaefer Eye Center Dry Eye Institute. As you all know, we do a lot of television shows and discussions about the dry eye, and it's so important today that we really capture those patients with dry eye early so we don't have long-term complications. You know, at Schaefer Eye Center, it's all about the evaluation first. When you have an eye exam, if you're diagnosed with dry eye, we just don't hand you a bottle of tears and say, here, try this. We know you've already tried that, and generally, tears by themselves do not work. So what we have here is an array of products that we deal with every dry eye patient. And it starts with, again, an artificial tear. It may go to an ointment or a gel. And then we also prescribe steroids to really knock that inflammation down. But we got to be careful with those because they have a lot of side effects. So we have to watch you a little bit carefully. We all know about Restasis. And again, a lot of people have tried it and they feel like, well, that's great or it doesn't work. It's not just that you've tried it. It's how you're using it and what other drugs you're using with it. We know that meibomian gland dysfunction is the #1 cause of dry eye. So the first thing we want to do is test you to find out how the secretion is in your glands. And that's what this test is. It's a test for secretion if you have the problem. The next thing we want to do is drain those glands. Now we may use something as simple as this, which calls a masking expression. And we actually will have you come back 3 or 4 times. We'll actually help the glands express, but most important, we have something called LipiView and LipiFlow. It's a whole new system to really treat those glands. We'll talk about that in just a few minutes, but let's first talk with the diagnosis. With the diagnosis, we have lots of dyes and tests we do to find out what level of dry eye do you have? Is it caused from your lids? Is it caused from your eye? Is it caused from medications you're taking like antihistamines or birth control pills? Is it caused by hormone replacement therapy or simply just your age? There's so many things that go into a dry eye evaluation. Now, once we evaluated you, we have, again, so many things to do, including punctal plugs. And you may say, well, I've tried plugs. There are so many different plugs that we use at Schaefer Eye Center because everybody needs a different plug. But one thing we don't do is put a plug in that we can't remove easily, because we know punctal plugs can cause problems if you use the wrong plug in your eye. Also, we rarely ever use a punctal plug until we've cleaned up the eye and make sure that we have a nice, clean tears in order to then plug and keep those tears in the eye. Lastly is sleeping at night. A lot of people think they have to tape their eyelids shut at night because they don't close their eyes completely when they sleep. That's called lag ophthalmos. Well, we have lots of devices now, including things like nighttime glasses, if I can get this out for you, that you can actually put drops in and have not only a sleeping lens on your eye, but it's moisture to the eye while you sleep. Now again, we do that in people that have very dry eyes or have trouble sleeping because of those dry eyes. And again, the issue is, what is your problem? What's the diagnosis? And how we're going to treat it. Next, we're going to move to the most important new device. It's an amazing device that truly not only will take care of your dry eye, but actually treat the dry eye. Because there's one treatment for the dry eye, and that's called treating the meibomian glands as meibomian gland dysfunction, and that's done with LipiView and LipiFlow.
The LipiFlow system uses heat and pressure to clear blocked meibomian glands. By applying heat directly to the glands on the inner eyelid surface, heat rapidly and efficiently raises gland contents, liquefying any blockage, making it easier to remove from the gland. Pulsatile pressure is applied to the outer eyelid surface, moving from distal to proximal ends of the glands. This action moves the blockage towards the gland opening and evacuates the contents. During this process, stagnant gland tissue may be removed from the glands.
Now you've seen how to diagnose a dry eye, how we're going to treat a dry eye, and most importantly, how we're going to make your life better. At Schaefer Eye Center, we are about taking care of your eyes.